and Neha, stay with us because also I'm joined by Anil Dhal, who is a cardiologist. Doctor, thank you so much for speaking to Mirror Now on this very critical issue that we're discussing this evening. According to you, what could have possibly gone wrong with the cosmetic surgery? Because we know it is very popular, especially among celebrities in the entertainment industry. What could have possibly gone wrong? What are the risks and dangers that one is signing up to when they're actually undergoing the surgery?
So to be honest, I really don't know what could have gone wrong, what has gone wrong, because that needs a case-by-case evaluation. But you must remember that any surgery can have complications, and those complications, usually there is informed consent which is taken by the practitioner, and I'm pretty sure that in the case of a celebrity, everything had been discussed with the patient even beforehand. But what I actually, when somebody spoke to me, and I thought that, yes, we should add our two bit to this very unfortunate piece of information and news, is that one should not get carried away by the tragedy which is unfolded here. This is unfortunately any interventional procedure or surgery can have complications. Many complications are known. Sometimes abnormal metabolisms in individuals could have even higher complications. Suppose somebody's been on certain drugs or something, the complications can be even higher. But what I want to really highlight is that for a lot of people who presume that looks are synonymous with health, it is not true. Beauty actually lies much deeper within. And just as it is very dangerous for society to indulge in fat shaming, must remember that it's not only surgical procedures, but even, for example, excessive exercise can be dangerous. And we have always recommended a middle path. And also, many gym instructors tend to motivate those who attend their gyms. They compel them, the gym goers, to have who are desirous of attractive bodies, to take supplements and certain drugs, which can be very, very dangerous and almost lethal in some cases. So we do not know what is the background to this unfortunate tragedy having happened, but we would like to sensitize all the viewers and listeners that one has to be very careful and judicious about all of this. Avoid excessive exercise. Take the middle path. It should be done gradually under medical supervision, and also to avoid supplements, and especially when people start taking drugs like steroids, anabolic steroids, or in cutting cycle, people use clenbuterol for weight loss to get desired bodies. It is not appropriate. And believe me, it is better to be healthy rather than and a little fat may not really go against you in terms of longevity and health.
Important advice coming in from Dr. Dhal there. Certainly, it's very important for our viewers. They could take note of this. Also, doctor, it's imperative for people going in for plastic surgery to make an informed decision when it comes to certain procedures. What should a person look at in terms of clinical procedure or the medical framework, if at all they are considering going under the knife?
Ma'am, I would say that any surgery, and by the way, it is a legal stipulated requirement. All of us practice that even for the smallest bit of intervention, we have to take informed consent. We discuss with the patient and the caregiver. Now, of course, in your case, what you were telling, the father did not know. I can just say that there is normally a next of kin that you discuss with, and there is the patient himself. An adult patient, completely in control of his or her senses, would be in a position to give consent for a procedure. So I think the appropriate would have been done by our medical fraternity, and I'm sure that is not at fault. This is very unfortunate that this has happened, but the pre-morbid condition of the patient, so suppose it's just a liposuction procedure, for you it's just a plastic procedure, but this patient may have tried to adopt certain strange fat diets, or taken a lot of supplements, or taken a lot of different drugs to try and achieve this, even without going under the surgical knife. and that patient could have a host of medical conditions which could work adversely against her. So this entire concept of fat shaming, I think we should try to get more comfortable in our own skin. Yes, work towards fitness, work towards good health, but use standard techniques and not get carried away by either doing extreme diets or extreme fat diets or extreme exercises. They are not good for us.
That's right. A very important point being made by Dr. Anil Dhal. They're talking about body positivity, which, when you talk about the entertainment industry is the lowest. Of course, you have several celebrities of late who've come out to talk about body positivity, who are sort of against plastic surgeries. But if at all you are going in for one, the doctor's advice is to look at all the medical framework, look at all the guidelines that are being followed. And at the end of the day, what Dr. Anil Dhal is saying is that to believe in yourself, believe in the body you have, and to not pay attention to fat shaming, and of course to get rid of the taboo that's sort of in society where people do fat shame or name call or name tag people. That stereotype and that practice needs to be done away with. Only then perhaps we can develop as a society. Thank you so much, Dr. Dhal, for joining us this evening with your perspective.